Welcome to the Human Momentum Podcast. I'm your host, Erik Schabert. I created this podcast to leverage 12 years of osteopathic medical training and over a decade of experience in primary care medicine to help sort through the confusing and often contradictory health information found on the internet. I want to distill all this information down into a form that you can use every day to optimize your health as you move forward through life. So if you are looking to get to life's finish line with the ability to do all the things that you love intact, then this podcast is for you. If this is your first time here, please don't forget to smash the subscribe button and throw us a like as well. I'd also love it if you would share this episode with people in your life who you believe can benefit from it. It really helps us get this information out to more people. With all that said, let's move on with today's episode. Hello and welcome to today's episode of the Human Momentum Podcast. Today, I want to expand on a previous short form video I did that talked briefly about what I was doing to manage my own health and health screenings. And I want to use this to illustrate a template that any individual can use in conjunction with a primary care physician they're working with to screen for potential problems and optimize their own health as they move forward through life. All right. At the end of this video, I will also discuss what I would be doing differently if I were a woman, since all of the things I'm going to talk about with regards to my health are going to pertain to a male patient. The first thing I want to discuss is how I look through my own personal and my family history and use this to determine what things I'm going to be worrying about as I go forward and what things I want to prevent. First off, I'm going to talk about my parents. They are both currently in their 80s, and my father will actually turn 90 later this year. They have some substantial health challenges. With regards to my mother, a lot of this revolves around musculoskeletal health. And she, as well as my father, both would be diagnosable with a medical condition called sarcopenia. And that means a lack of muscle. It means they have poor strength. And in the case of my mother, it means she has poor balance and is prone to falls. My father has additionally suffered a stroke almost 9 years ago now. And this has left him with partial left-sided paralysis that compounds his sarcopenia issues and has, in some cases, fed them as when he has had exacerbations of some of his symptoms surrounding his stroke. And when he had a prior fall and a hip fracture, he lost a great deal of additional muscle mass and strength. And this has left him where we have had to go through physical therapy and very much work with him just to get where he can transfer from bed to chair, from chair to commode with a minimum amount of assistance. And that is something that is very difficult for him and for our family. So these are things I want to prevent. Both of my parents also have mild cognitive impairment with some memory loss. This is also something I'm looking to prevent. On both sides of my family, there is a strong history of cardiovascular disease. My maternal grandfather had heart failure. My paternal grandmother had heart failure. And my paternal grandfather had a stroke and was quite disabled at end of life. Both my father and his father had high blood pressure, which was the primary risk factor associated with their strokes. So this all becomes something that I am very focused on. My grandmother had Parkinson's, and there is some family history of neurodegenerative disorders, but there is not as much to be done screening-wise for these particular problems. Also of note, there is no family history of blood sugar issues or diabetes. Bit unusual in today's America, but nonetheless the case. So I'm a little bit less concerned about blood sugars. I am still getting myself screened for blood sugar issues, but not at the highest index of suspicion level that could be done. My father has also had several skin cancers, thankfully all of which were caught early. But as I am also fair skinned and had a large prior history of sun exposure with several severe sunburns, it is something I'm concerned about. All right. So with that history noted, the place I have started for health screenings is with blood pressure. And sure enough, in my late 40s, when I was going through a rather stressful time that I hadn't been taking care of myself as well as I should have been, I developed hypertension. I actually had one reading of in the 170s over 110s, obviously a major concern. As such, I am currently on two blood pressure medications. I check my blood pressure regularly, at least twice a week. And I would recommend anybody who is concerned about blood pressure issues be checking their blood pressure at home. Getting additional readings is always helpful and informative. And it is just too easy for the very occasional blood pressure readings you get at the doctor's office to not catch a problem as it's coming up. Also, I am getting my cholesterol markers and metabolic issues checked once a year. When I talk about metabolic issues, what I'm talking about is a standard metabolic panel that's going to include a fasting blood sugar, liver kidney functions, and electrolytes. Additionally, I'm getting a hemoglobin A1C every year just because I want to keep an eye on it. If my blood sugar was creeping up, that hemoglobin A1C was creeping up towards the 5.7 cutoff for prediabetes, I would definitely be looking at getting a fasting insulin level so I could try and do some of the fancy calculations for insulin resistance to see if there was a problem developing that I needed to catch early. The fact is, at this point, I am almost right down to my ideal body weight. I have a pretty good ratio of lean mass to adipose tissue. My waistline is well under the cutoff for metabolic syndrome. And as such, and with my exercise habits, I don't think blood sugars are going to be a major concern for me going forward. As far as lipids, I check a standard cholesterol panel as well as an ApoB. ApoB is an emerging risk factor that is probably the single best marker for lipoprotein related heart disease risk. It is a better, more predictive number than LDL, than triglycerides, even than non HDL. As it's also an inexpensive blood test, I don't see a reason not to get it because I know how to utilize it. In any case, something to be aware of. We used to think of high HDL as very protective against heart disease. We don't really believe that to be the case with the most current evidence we have. We've had numerous times where drugs attempting to raise HDL failed to reduce cardiovascular risk. We've also seen quite a bit that having a large HDL does not protect you against the adverse effects of an elevated ApoB or elevated triglycerides. HDL is useful nonetheless because one of the earlier predictors of insulin resistance is elevating triglycerides in the setting of lower HDL. So a low HDL in combination with elevated triglycerides can very much be an indication of insulin resistance. And this is an important risk factor to notice. With regards to blood pressure, my target is 120s over 70s and below. And what I'm doing from an interventions perspective to try and keep my blood pressure under control, in addition to medication, is I am getting between 50 minutes and an hour of cardiovascular exercise 3 days a week. And I'm getting about 30 minutes of resistance training in a week. Additionally, I am trying to meditate 15 minutes minimum. And I'm trying to work towards 30 minutes and do that on a daily basis. That has also been shown to reduce blood pressures. I am also eating a high fiber diet, and I am trying to get as much in the way of omega 3s from heavy fish dietarily that I can manage. These things can all help both lipid profiles and can help blood pressure. I'm also attempting to get 15 to 30 minutes of mobility exercises in at least 6 days a week. This is trying to address balance and also trying to improve the mobility and dynamic stability of my shoulders, my hips, my pelvis, and my abdomen. In doing this, I am hoping to minimize pain as I get older, improve function, and prevent falls. All right, so from there, let's move on to what I'm doing for cancer screening. The primary cancers I'm concerned about as a male that we have very good screening for are colon cancer, prostate cancer, skin cancer, and lung cancer. From the standpoint of skin cancer, I'm getting an annual skin survey by a dermatologist. And about once a decade, I am doing field therapy of my head and neck just because of the number of sunburns I've had previously. I'm trying to minimize my chance of getting basal and squamous cell carcinomas in those regions of my body. Also, I am getting a PSA done. The prostate specific antigen blood test is useful for screening for prostate cancer. I had my first one at age 50, and I have had two since, the most recent one this year. The way to use these is to look both at a baseline and a rate of change. My baseline was thankfully very low. And so if mine were to even to jump up above one at this point suddenly in one interval of testing, that would be indication that I need to look at this a little more closely and there could be a cancer growing. There is a new test called iso-PSA that can be used when you have a positive PSA test prior to potentially give us a better idea if you need a biopsy. Hopefully, with iso-PSA, we can do PSA screening more regularly and later into life without generating unnecessary biopsies and interventions. With regards to colon cancer, I am using Cologuard, the histochemical test. Basically, you put a stool sample in a cup, send it off to the company. They test it in a number of different ways for evidence of colon cancer being present. Its sensitivity is within a few percentage points of colonoscopy. It's done every 3 years instead of every 10 years, but it can avoid the unpleasantness of having to do the clean out for a colonoscopy scope. Now, if it comes up positive, I'm just moving on to colonoscopy. So, effective way, I think, of doing colon cancer screening. With regards to lung cancer, I am not a smoker. So, per the current guidelines, I would not be eligible for lung cancer screening. However, because of the fact I've had fairly extensive secondhand smoke exposure in my youth, and I worked in some industrial areas while I was in the US Navy, I am concerned about the possibility of lung cancer despite my having never smoked. Because of this, it is my intent to start doing annual screening with low dose CT scan later this year. Although, because I don't fit the standard risk profiles, insurance isn't going to pay for it. So I have to save up my pennies to pay out of pocket. This is definitely something to discuss with your doctor if you have concerns. Again, as of right now, even though we are beginning to recognize, research is starting to point out that there are more cases of lung cancer in people who've never smoked than we previously recognized, the current recommendations still don't say to get screening if you've never smoked. Again, something to discuss with a physician if you're concerned about it. One other thing I would like to touch on is that I have not been getting my testosterone or thyroid levels checked, and I don't plan to. I think this is something that only should be done if you have symptoms that are consistent with low levels. And it should be a constellation of symptoms because every symptom of low testosterone, every symptom of low thyroid is what we call a nonspecific symptom. There's a lot of things that could be causing that sort of thing. And as a result, I think it's important to only do the screening if a physician evaluates your entire constellation of symptoms and thinks it may be indicated. And that brings me to the additional screenings that I would recommend for a woman of my age, or I would be pursuing myself were I female. So, for the most part, the issues you would be concerned about in potential screenings would be identical. There are some subtractions and additions. First off, you obviously are not going to be worrying about prostate cancer risk if you're a woman, but you would be concerned about the potential for cervical cancer, the potential for breast cancer, and the potential for osteoporosis is a little bit more prevalent in women, although an argument could be made that for men who are not doing regular resistance training, that screening for osteoporosis risk would be wise. In any case, for women, we do recommend as soon as you're approaching perimenopause, about age 50 or so, that you begin getting annual bone density screening so that we can intervene early if necessary. Something to be aware of for women who are either concerned about osteopenia and osteoporosis or have been diagnosed with it. The black box warnings on estrogen products were recently removed. So if you're having a bunch of perimenopausal or menopause related symptoms and you have bone density concerns, estrogen becomes a very good potential treatment. Additionally, women should be screened for cervical cancer. This should start at age 21 or within 2 years of beginning sexual activity, whatever is first. This screening would include a pap smear with additional testing for HPV, the human papillomavirus. That is the virus that is responsible for most cervical cancer in the United States. Additionally, women should start getting mammograms around age 40 and have them annually from ages 40 to 54 and biannually after until such time as a informed discussion with a physician results in you deciding to cease. Well, that is all I have with regards to all these different screening interventions. If you have any questions, please do fire away in the comments section. I will be happy to answer them if possible through YouTube comments. And if it requires a more extensive description, I will make a future video about the question. A reminder for absolutely every one of these things, the intention of this video is to get you talking with a physician in your area and develop a collaborative plan to optimize your health going forward. That's what I'm talking about doing here. I hope this has been informative for everybody, and I hope all of you can stay healthy and happy, and I will see you next time.